Welcome to Diagnostic Imaging's Weekly Scan. I'm Senior Editor Whitney Palmer. Before we get to our highlighted interview of the week on technology tools to improve patient engagement, here are the week's top stories. Across the country, the overall use of diagnostic imaging with pediatric patients is on the rise. According to a study published this week in JAMA Pediatrics, investigators from the University of Pittsburgh Medical Center revealed emergency departments are ordering more MRI scans and ultrasounds for children, but the numbers of CT scans are dropping. By examining more than 26 million emergency department records gathered between January 1st, 2009 and December 31st, 2018, the team calculated ultrasound use increased from 2.5% to 5.8% in patients, and MRIs increased from 0.3% to 0.6%. CT fell from 3.9% to 2.9%, declining in 8 areas. Concussion saw a 23% drop, appendectomy a 14.9%. Ventricular shunt procedures fell 13.3%, and migraine and other headaches reduced by 12.4%. Nervous system disorders dropped by 10.1%, abdominal pain by 6.1%, ear, nose, and throat by 5.9%, and seizure by 5.3%. The hospital also determined that more imaging was used for patients who were ultimately hospitalized. After several years of waiting, it finally looks like the appropriate use criteria first introduced in the Protecting Access to Medicare Act of 2014 might be approaching full implementation. In a session during the Radiology Business Management Association's Paradigm Shift 2020 virtual meeting, coding and reimbursement expert Melody Malayek, president of Revenue Cycle Coding Strategies, LLC, outlined where the industry sits with testing compliance to these guidelines and the use of clinical decision support systems. In her presentation, she outlined the G-codes and the CPT modifiers that must be used on claims to indicate your referring providers have consulted the appropriate use guidelines. Without these codes, once full implementation occurs, your claims will be denied when you submit for reimbursement. She also outlined several metrics by which you can gauge compliance. She suggested examining utilization by provider and practice both pre and post implementation, as well as evaluating primary and secondary payer denials, distinguishing between appropriate use criteria and medical necessity rejections. In addition, she recommended identifying any missing appropriate use criteria information by provider and facility staff to identify where omissions occur most frequently and segmenting out compliance by modality when appropriate. Over the past several months, it has become clear that the pandemic has touched radiology in a myriad of ways. In fact, the impact has seeped down to the residency program level as potential applicants and program directors are struggling to find alternative ways to meeting in person. In an article published in the Journal of the American College of Radiology, a multi-institutional group of residency program leaders pointed to several tactics residency programs of all sizes can use to distinguish themselves from the pack when online interaction is the only format available. In addition to keeping static websites up to date with the latest program information, the program directors highlighted social media and video conferencing as effective tools as well. With social media, they advocated for recruiting current residents and faculty to create photographic, written, and video material that can showcase the program's highlights. Featuring resident achievements on Facebook, Twitter, and Instagram accounts, especially those manned by the residents themselves, can also be effective. For video conferencing, the directors suggested standardizing backgrounds and equipment, as well as incorporating institutional logos, and using video tools to conduct mock interviews, host question and answer sessions with individuals who have recently gone through the match, and plan virtual happy hours are also great ways to give potential applicants the clear idea about the personality of your residency program. And social media is making headway into radiology beyond helping residents choose a program. In a new study published in Emergency Radiology, investigators from Louisiana State Health New Orleans School of Medicine tested whether the time-constrained app Snapchat could be an effective tool in training residents in emergency room image interpretation. The answer is yes. During a 4-week study, researchers presented 7 residents, 4 juniors and 3 seniors, with 5 emergent radiologic cases using Snapchat, and 5 similar cases using an overhead projector in the classroom. Across the board, the residents performed better with Snapchat. The cumulative score among juniors was 81 out of 160 with the app and only 63 with the classroom projector. For seniors, their cumulative score was 88 out of 120 with Snapchat and 75 with the projector. The hope, the researchers said, is that these results will help promote active learning and engagement in remote teaching environments. And finally this week, Diagnostic Imaging looked at the efforts to improve care delivery, specifically with patient engagement. In today's environment, technology has become a powerful tool in improving these interactions. Across the board, it is being used to augment patient knowledge, skills, and improve a patient's interest in participating in his or her healthcare. Not only does it enhance communication with patients, making them feel more empowered, but it can also increase patient satisfaction rates. We spoke with Dr. Alexander Tobin, Associate Chief of Clinical Operations and Informatics and Chair of Radiology Informatics at Cincinnati Children's Hospital Medical Center, about his facility's experience with the role of technology in patient engagement, as well as some best practices. Here's what he shared. All right, well, thank you so much, Dr. Tobin, for taking the time today to talk with me. I really appreciate your discussing your SIM presentation, focusing on the use of technology to improve the patient experience. Thank you for being here.
Yeah, thanks for having me. I'm excited to talk about the session. I think it's going to be a really good one.
Oh, absolutely. And I'm excited to hear what you have to say. So to jump in, from the overall perspective, when we think about the patient experience, why is it so important to consider technology as a tool to improve that engagement?
It's a great question. Technology can be a great equalizer. It can be a tool that pushes us apart, but it can also be a tool that brings us together. It helps to lower bars and make things easier. And that's really what we tried to focus on in our department, and in meeting patients with where they were and trying to find new ways to get in touch with our patients. Through the session, I share a couple of examples in my talk of ways that we try to engage our patients. And it's about that. It's going to meet the patient at where they are, at their level, where they want to be, and trying to engage them in their healthcare. I work at Children's Hospital, and so a lot of times that means engaging parents. Not always. Sometimes we're trying to engage the kids themselves, but engaging parents to bring their children into the hospital. And so an example of that is social media. One of the first things that we say is not all social media is a patient engagement experience. You have to really focus on the patient as the target audience, or in our case, the family is the target audience. But we have a tool to get information to the families when they need it. And so we really try to do that through our blog, for example. The blog, we know that no one reads our blog every day. It's not a blog designed like that, and I don't believe most healthcare blogs are, but it's there when you need it. When your child's sick and you have a question, we know that you're going to turn to Google, and we want to be there for you when you have that question. And so that's sort of passive patient engagement. We also have tools to actively engage patients. An example of that is we built a text messaging app to remind families not only about their appointment, but that we had a change of location. We were doing some construction on our hospital and had a temporary location for MRI. And so we wanted to send families reminders of that appointment and that location in case they were having trouble finding us. And so that text message included directions to the new location, a phone number where they could call and ask for help. And it was sent in a semi-automated way.
All right. Well, I want to circle back around to some of those tactics in just a minute. But when we think about interacting with families, and like you said, usually it's parents, but also it's pediatric patients as well.
Yeah.
What is the overall role that you hope these types of tools will play? I guess, from an end goal perspective.
When the goal is trying to activate patients. So engaging them in their own healthcare, and then getting them to do the things to take control of their health. That's really the end goal of all of the different activities.
Okay. Well, then coming back to the strategies then, and maybe some best practices for facilities that are looking to start using these types of tools, are there certain things that they should keep top of mind when they're starting to go down this road, and various strategies, like you mentioned, the blog or Facebook
Yeah.
or anything along those lines that maybe they should think about using first?
We tried to go around a strategy of thinking about the entire patient journey through our system. And from the provider point of view, we talked about the value stream of or the different steps that a patient takes as they go through our system. Um, and so we try to find elements to engage our patients at every step along the way. And so that's um, from the moment the order is placed. That's something that happens to them in relation to radiology. They're in discussion with their physician who's placing the order, and there is engagement at that level. But once they move into radiology, the order is placed, and so we want to do things to try to get them engaged from that level. And that's where, so once the order is placed, the first thing a patient may do is research to figure out either the location that they want to have their imaging performed, or what the condition that their imaging is supposed to identify. That's where an example like the blog comes in. Scheduling would be then the next step. That's been a place where radiology has not done a great job traditionally. We have challenges with the online scheduling. This online scheduling is in every aspect of our world, but it's a hard thing to do in radiology. We rely on an order. Not everyone has that order electronic. It's not in every system. And so there are unique challenges with that many places haven't solved. And then it becomes prep instructions. Many tests, not all of them, but many tests require patients to have something to be prepared for the test. That can be not eating before the test for a certain amount of time, or even drinking something ahead of their test. And those type of things. How do we give instructions that meet their needs instead of it being sort of cookbook where everyone receives the same instructions? So we try to look at things along every step of the way. And do things to make it easier for our patients. And eventually getting to the point where we're empowering them to take care of themselves or to be a partner in their healthcare. And so many of the things I was describing are sort of passive, where we put it out for the patients, but they have to do something, like if we were doing online scheduling. Other things can be more active, sending them their results and trying to engage them in the results, giving them options for having direct conversations with radiologists or getting direct results from radiologists. Other examples would be just giving them their images and not doing it on a disk and a media that they can't use, but giving them ways so they can see their images through the patient portal in the way that they're interacting with the rest of their healthcare. And so we try to do things along that entire spectrum.
All right. Well, those are all fantastic tactics to use. And you touched a little bit on some challenges, but are
Yeah.
there other challenges that, kind of pop up that might slow this down or make it a little more difficult for a facility to use these types of tools for engagement?
Yeah. From a radiology department perspective, it's a paradigm shift for us. As much as we don't like to admit it, patients have not been our primary customers. When we think about it, we've done everything over the past 2 decades to make it easier for the ordering physicians to do their job. And so that includes spending millions of dollars to install a PACS so that we can distribute images throughout an enterprise. It includes having voice dictation systems so we can improve turnaround times. There are side effect benefits to patients, but it's really to improve the lives of the ordering physicians and the rest of the healthcare team. But we've not spent that same kind of money or made the same type of investment to do things to benefit our patients in that same way. We don't have tools that create a lay person or lay language of our reports. We haven't We still use disk-based media, even though computers haven't, Apple stopped producing computers 8 years ago, and it's been over 10 years since they started introducing computers that did not have a disk drive. And yet we still give them. People can't use them. There are very few, even hospitals that have disk drives in their computers now. And so we're still reliant on this old technology. We haven't taken that leap to the next level. And that's coming from a couple of ways. The patient portals are helping that. Patients are getting more and more involved. The age of patients who are used to using computers has changed as the population demographics change. All of those things are leading to a greater investment and a greater willingness. The other thing is then time. Radiologists aren't we're not paid to go talk with patients. We're paid to read studies. And so that time away from reading studies cuts into the productivity needs of the department. We're not staffed to be able to do those things, even though in many cases it doesn't take a lot of time. But it's just not the way that our practices are structured. And so it's a complete paradigm shift for each of us.
All right. Well, even with those challenges
Yeah.
that seem to be, pervasive throughout the industry, what can we point to as the benefits of really making an effort to start using these tools to engage patients, both from the patient perspective and even from the provider perspective as well?
I think the best reason is we're trying to improve healthcare. And when patients are engaged, they have more stake in their own health, and that leads to improved healthcare. It leads to better outcomes for all of our patients. It helps us to serve marginalized patients better, to reach underserved populations better, to go out and actively get them interested in their health. It helps. And that's why most of us go into medicine, into a specialty for any reasons. We want to help people, and that's helping the maximum number of people in the maximal way.
All right. Well, then turning and thinking specifically about Cincinnati Children's, you
Yeah.
talked about the blog earlier. What, I guess, have been some of the most successful strategies that you've used, feedback that maybe you've seen on ones that are most popular or most effective?
Specifically related to blog posts or to
To
it's just in
patient
general.
engagement, right?
Yeah, I think that to me the most important thing that we've done is having a patient advocate on our staff. She's been on our staff for over a decade. Works in the reading room, or not in the reading room, I'm sorry. Works in the waiting room mostly. Is there to listen to patients, to hear the problems that they're having with our service, to address their needs on the spot, and then identify patterns where we're failing, and can make improvements to better serve our patients. That's the kind of thing I wish every department would have. It's so powerful to have, for the department of our size, having one advocate is enough to staff our room, to staff our needs, but larger departments may need more. But having patient advocates on staff really says that we care about patients, I think.
All right. Well, then taking a step back and thinking about the session overall, for providers who may not have the opportunity to watch, the session or participate in the Q&A, what are
Yeah.
some takeaway messages that you feel like would be most important for them to carry with them?
There are a couple. One is think about the patient at every step of their journey, from their point of view, not just from the imaging provider's point of view, not from the radiologist's point of view, or from the technologist's point of view, but think about it from the patient's point of view. Where are their fears? Where are their frustrations? And try to address them. The other, I think, takeaway is listening, asking and then listening to our patients' needs and those same fears and frustrations, and trying to do things to address them.
All right. Well, Dr. Tobin, I appreciate your taking the time today. Thank you so much.
Yeah, no problem. Thank you. I appreciate you asking me the questions and talking about this. It's such an important topic.
Absolutely. It's my pleasure.
Thanks.